I was born with a heart problem, cardiomyopathy. My first transplant was at Riley when I was about 2 years old. I had to have another transplant when I was around 16 back in 2015. That was a new experience for me because I was more aware of things. Having that life-changing experience was very eye-opening for me. So, I kind of realized that you have to live in the moment and be aware of your surroundings and, be be happy every moment. I feel really fortunate to be able to have, not even once, but twice have the opportunity to have, the chance at life. You feel like you're put on this earth for a reason, and having a transplant helps you become more aware that you have to live in the moment, like they said, and you have to do your best every second that you have, because not many people get second chances, not many people get 3 chances at life, so to be able to have that is really awesome. I started art therapy during my second transplant. I've always been more focused with art, so that really caught my eye, and I started working with Cassie, and she did a really awesome job of having to help me process the emotions and having an outlet for me to draw and actually not be bored while during in the hospital. I don't know, it helped me improve my emotions a lot and helped me organize my thoughts more, and I became a better artist, I think, as well.
So here at Riley, we have 2 full-time art therapists, and we are strictly inpatient units. An art therapist, we are master-level mental health counselors, so kind of can be sometimes disguised as an art-making session, but we're always using that therapeutic relationship as part of the intervention. Paulina was easy to work with because she already liked art from the beginning, so I didn't really have to do much convincing to get her to come out and make art with me.
I mean, I've always been a very open person, but having to have I could calm down and draw and do something that I could really enjoy, and having to talk to somebody that understands what I'm going through or can process it in a more psychological way helped me to just be more relaxed and more calm, and I think everybody could really benefit from art therapy. With my portraits, before I didn't really use color, it was just pencil. And then afterwards I switched to more colorfulness, more liveliness, more creativity, more detail. I like skies a lot. When I was in the hospital, I had a window, but it wasn't I could barely see outside. So whenever I was in the hospital, I'd draw a lot of skies a lot because I miss seeing that. So I think it's something that should be not taken for granted that you can see every day. So I like that. While you're having a transplant, you're not allowed to have flowers because of the bacteria or something that it might carry, so I focused a lot on drawing flowers as well. I just kind of got an inspiration from my heart transplant as well, just kind of with the flowers you can see it's more I felt more lively, more I blossomed into the person that I was meant to become. Currently I'm studying art therapy right now. I'm hoping to get my undergrad in psychology and then go do a graduate program for art therapy. I'd really like to work at a hospital or somewhere with children that have gone through maybe similar things or some gone through trauma or something, because I think that if I was put on this earth for a reason again, then I have to do something that can help other people. So yeah.